Post-operative instructions. It is important for a blood clot to form to stop the bleeding and begin the healing process. That's why we ask you to bite on a gauze pad for 1 to 2 hours after the appointment. If the bleeding or oozing persists, insert another gauze pad and bite firmly for another 30 minutes. You may have to do this several times. Minor bleeding or blood-tinged saliva may occur the first 24 to 48 hours. Bite on a gauze for 2 to 3 hours following the surgery. If heavy bleeding still occurs, either replace the new moist cold gauze or a moist tea bag and bite for an additional 1 to 2 hours. Do not drink through a straw, suck on candy, or smoke for at least 1 week following your surgery. After the blood clot forms, it is important not to disturb or dislodge the clot, as it aids healing. Do not rinse vigorously, suck on straws, smoke, drink alcohol, or brush teeth for 72 hours. These activities will dislodge or dissolve the clot and delay the healing process. Limit vigorous exercise for the next 24 hours, as this will increase blood pressure and may cause more bleeding. If heavy bleeding occurs, use cold, moist gauze or a tea bag and bite for an additional 1 to 2 hours. No straws or carbonated beverages for 1 week post-surgery. You may feel some pain and experience some swelling. An ice pack or an unopened bag of frozen peas or corn applied to the area will keep swelling to a minimum. Take pain medications as prescribed. The swelling usually subsides after 48 to 72 hours. Pain. Medication has been prescribed according to your anticipated level of discomfort. Take pain medication before numbness from the local anesthesia wears off. Repeat as needed according to the schedule printed on the prescription bottle. Take the medication with a milkshake or other soft food to avoid nausea. Do not drive, operate hazardous machinery, or drink alcohol while taking the pain medications. You may also take 2 ibuprofen, Advil, every 6 hours, beginning the day before surgery, and continue taking them along with your prescription medications after surgery. Ibuprofen, 400 to 600 milligrams, alternating with prescription medicine every 4 to 6 hours, may be helpful. Please let us know if you have any problems with ibuprofen or other NSAIDs. Do not take Advil or Aleve if Toradol, ketorolac is prescribed. Drink lots of fluids and eat nutritious soft foods. You can eat normally as soon as you are comfortable. It is important to resume your normal dental routine after 24 hours. This should include brushing and flossing your teeth at least once a day. This will speed up healing and help keep your mouth fresh and clean. Rinsing. You may drink, but not vigorously rinse your mouth for the first 24 hours following surgery. After 24 hours, gently rinse your mouth with warm salt water. 1 teaspoon of salt dissolved in 8 ounces of lukewarm water, 4 to 6 times daily. Continue rinsing until you return for your post-operative exam. You may gently brush your teeth the day after surgery, being careful in the area where the surgery was performed. Sutures. If sutures were placed, they will dissolve on their own, approximately 4 to 7 days, unless you are told that non-dissolving sutures were used. Sutures may loosen or come out prior to your next appointment. This is normal. After a few days, you will feel fine and can resume your normal activities. If you have heavy bleeding, severe pain, continued swelling for 2 to 3 days, or a reaction to the medication, call the office immediately. Be assured that our interest in your well-being does not end with your surgery. If you have any questions or problems, please call us at the office number. Help will always be available. A post-operative appointment will be made for approximately 1 week after surgery, but we would be happy to see you sooner should the need arise.